Good evening, everyone. Today, I have the pleasure of having Dr. Rema. Dr. Rema got INSS All India Rank 3 in this April Pediatric Oncology exam on AIMS Merit List 3, obviously. So I know her personally, obviously, because of the mock interview from that day, and we connected over. I think we once connected over Instagram also, and a great pleasure and obviously a great proud moment that obviously students of DocTutorials are getting great ranks. And so I thought that we'll have this interview where she can talk about her insights on how she prepared for NEET SS and how she prepared for INISS. How is preparation for AIMS and INISS in particular a little bit different? How you too can crack the exam, and what she liked about the platform, and in general the preparation strategy for anyone aiming for a top rank as far as INISS is concerned in the pediatric subspecialties. So hi, Dr. Rema. First of all, congratulations.
So thank you, sir.
Congratulations. So can you just give us a little bit of background of where you're from, where you did your post graduation from, and how did AIMS come into picture, or how did INISS come into picture?
Okay, I'm from Goa. I've done my UG MBBS from Goa Medical College, and I have done my DCS from Goa Medical College. Then I did my secondary DNB in Mehta Children's Hospital, Chennai. Then after that, I was currently working as a junior consultant in South Goa District Hospital. So my aim was actually to always do pediatric oncology, but not always. After my DNB actually, but I had never aimed for AIMS. The only exam I wanted to get through was NEET SS. That is either wanted to get into Tata's in Mumbai or Kidwai in Bangalore. So AIMS was never the thing. So when I answered a NEET SS last year, my rank was around 239, and I was getting the two other colleges apart from Tata and Kidwai. That's when I thought I will, because INSS was there immediately again 1 month later, and then it comes again in April. So that's when I prepared. I actually did not, whatever NEET SS preparation was there, I had just answered INSS that time. That is in November, but then I did not get through that time. I did not qualify, and I answered it again now with my thorough preparation. And then this time is when I qualified. So what I will say about the difference between NEET SS and INSS is I'll say NEET SS is little bit, it's very vast. What preparation we have to do I don't feel it can be done in a short period of time. It has to be, it's first of all, it's your preparation which you're doing in your PG, and then you try to make it more strong and make it more solid by after your PG prior to exams. So, but whereas in case of INSS, main thing is you decide your branch, which branch you want, and then you study the book of that branch, which is supposed to be studied, and do that more thoroughly. I feel give your full heart and soul into it, and that's when probably INSS could be maybe like I feel could be like easier sometimes even a NEET assess, because NEET assess, apart from general pediatrics, even each subspecialties like pediatric cardiology, pediatric gastroenterology, then even pediatric hemato-oncology, each thing is being asked like even more in detail right now. So the preparation, whatever you do, will never be enough. Whereas in INSS, I wouldn't say it is a easy exam. It is tough. It is equally tough, but it is only just one subject, so you can read it. Probably you can even just read it again once, so that you can go answer. You can at least answer the exam by reading a given book and say that you have studied at least a pediatric. And another good thing about INSS is that you are studying the book of your choice, like whichever subject you're reading, a subject which you want to get into. Like for example, pediatric oncology or pediatric hemato-oncology, I wanted to get into. So when I read Lenzowski, it was nice. So because it will be something which will be useful for you later. Whereas when you're studying this, it is good because as a pediatrician, we obviously each and every subspecialty is also important. But since this is your subject of your choice, obviously it is much better that you can study the subject which you want along with the general pediatrics. General pediatrics, obviously, we cannot miss it anywhere. Even after you do your DMFL, general pediatrics is like base. We are like is the first brick, obviously, beyond which you have to build everything. So that cannot be forgotten. Yeah, that's it.
So in a way, you would say that obviously INISS per se is not an easier exam, but simply
Yes,
by the virtue of the fact that you're focusing on one subject, it
yes,
slightly becomes less, I would say, less vast. Like, NEET
yes.
SS is like sort of endless in some way,
You are
while
correct. You're just
INISS,
eliminating certain things. Yeah,
yeah, in INSS, you can at least be like, okay, chalo, if I'm doing pediatric oncology, or pediatric
focus
hematology
on.
oncology,
Yeah,
I can just focus on Lenzowski. Or if I'm doing,
yeah.
let's say, I'm focusing on neonatology, then I just need to do Clohati and just need to do my NICU protocols,
Yes,
right?
correct.
So unlike in case of NEET SS, where you have to do your Nelson also, and then probably
Yeah,
maybe more in depth for like you said,
other
cardiology,
subjects.
gastroenterology. So that
Yes.
becomes a sort of it becomes way more vast. But obviously there, you have the option of getting a 100 200 rank and still getting a subspecialty. Here you
Yeah.
literally have to be a
You
single digit rank.
yes,
You
correct.
literally have to be a single digit rank like you got right now in order to get your branch of choice. All
Yes.
right. So, how did you get to know about when did you start using DocTutorials as your preparation
Okay.
platform for pediatric oncology, and what did you like the most about DocTutorials?
Okay, so about DocTutorials, actually for my NEET SS preparation, I had used other platforms, but after NEET SS was the time I actually thought now it has to be more focused. I felt, and since the main reason I took DocTutorials was because you were there on that, and since you were doing like you have finished your pediatric oncology DM in AIMS Delhi, I felt there couldn't be anything else. Then I wouldn't get more information about pediatric oncology than you. So that is the reason where that's when I took like 3 months before the exam. I took right to this INISS. I took DocTutorials, and the most important thing I feel I can advise anybody is to just go through the INISS recalls if you're planning for INISS. They are the best sessions, I think. Like if you're preparing for INISS, like for example, if it's oncology, I think your videos in pediatric oncology are like something like which is proper crisp, and everything has been given in that, like because it's very difficult to get the previous year's questions otherwise, and whereas here the recall sessions are very useful. Similarly be it for other fields also, like for example maybe in gastroenterology, like rheumatology taken by Dr. uh, Vishnu sir. So like that way I think the IISS recall sessions are the best, which is provided by, I think that is not there any in the platform currently.
Definitely, I think recall session, especially the INSS recalls that me, Vishnu, and Divya did. They are not available in any other platform, and like you said, I think they get you that flavor of the exam, especially as far as INI is concerned.
Yes, yes.
Like even if like the exact question is not repeated, you will get to know that okay, this is how INI will ask you questions,
Yeah.
and other platforms you really won't get to know about this.
Mhm.
And the best part is I would say that the previous sessions obviously they are no longer
Mhm.
available, but we
Yeah.
keep on conducting these free sessions. So anyone for that matter, you should definitely
Mhm.
attend them. And
Correct.
anyone who has attended them probably would have benefited from them.
Correct.
All right. So about the pediatric oncology videos, how did you like? Did you like them? And more importantly, like how did it help in your preparation? Specifically the
Okay.
pediatric oncology and the hematology oncology videos. Yeah.
Yes. Like for example, so since for pediatric oncology, the book we study is Lanzowski's. So if you go to see like each, for example, solid tumors like neuroblastoma, it will be like at least some maybe 12 to 14 pages. So like I used to do is I used to see the video first, get a gist about it, the entire thing, like probably which is the most common syndromes associated in neuroblastoma, then the treatment, everything in gist, and then I used to go to read, because if you start from the first page, it's very difficult to reach the last page when you start for the first time. But then so that's when like I used to go through one video and then go and read the given text, and then maybe there will be some points which I have to add into the, so I used to then read from the textbook itself. I didn't make my notes as such, but I have gone through Lenzowski purely. So then again, like towards the end also, suppose if I don't have time, I should just go to the video itself, just for me to brush up the given topic. Otherwise it becomes very useful to go through the topic. Like the videos will be, actually the videos are very short and crisp. They are not long enough that you don't have, because in our, because this is not like a UG preparation or a PG preparation, we all be working, so it's not possible to go through some long videos currently or something. So in short videos you get the gist of everything, and then you read the chapter, it becomes easier for you to prepare it. Especially you will tell the important topics. Like for example, in ELA, the cytogenetics part, which is there, at least the ones which are important for good prognosis or poor prognosis, were told by you, like those. But otherwise, if you go to the chapter, you'll have so many, and you won't know which is important, which is not important. So, like the focus which you have given to each part in that given topic is, I feel, very good.
So yeah, I think that's how videos should be. Matlab, videos
Yeah.
are, and I mean it with all sincerity. Be it be it any be it NEET PG or be it NEET SS also. The videos are not a replacement for your learning from Lenzowski or your learning from Nelson's.
Correct.
But
Yeah.
what they are excellent supplements to your knowledge. And
Yeah.
in a way, like you said, like they are meant there so that you can we, like you said, we all are working professionals. We are not
Yeah.
preparing for this
Not
exam like
preparing
sitting at
solely
home.
only for the exam. Correct. Yeah.
Yeah, it's not like we are all working professionals at this point of time. Some might be in their senior residency. You were
Correct.
you were doing you were working as a consultant, and everyone will be doing some work. People
Correct.
won't be
Some.
sitting at home and preparing for this exam.
Correct. Yeah.
So in such a scenario, like reading the entire Lanzowski it's possible, but obviously you will forget and you won't
Correct.
get the important parts of it. While video will
Hmm.
help you understand, okay, this is more important, and it will
Important.
stay in your mind, and
True.
it will be like, okay, within 45 minutes, 40 minutes, you
Hmm.
got through the entire chapter or the
Right.
entire topic, right? So
Correct.
that's how that's a perfect way to use videos. Matlab, frankly,
Yeah.
I'm like, people try to replace it, but
Yeah.
like you said, they are supplements which will enhance your preparation to the next level, rather than if you solely rely on them, then obviously that's
I
not the
feel
way we
no,
should.
that's not the thing. Yes.
That's
Like
not the way it
initially, I
should.
used to think like the videos, pediatric oncology full videos you are done. That doesn't mean the oncology part is done and you're ready for the exam.
Yeah,
The main thing is it cannot be a replacement. This is like one thing.
yeah.
Actually, I had thought initially, videos, if you see it done, you are prepared for the exam, just answer some MCQs, that's it. No, but I think reading the book is most important
Important.
along with the
Reading the book is
videos.
definitely along
Yes.
with the videos,
It
and videos
cannot
will
be a
help you
replacement.
yeah, video will make you understand the important parts, will make you understand the
Yeah.
important
Your
topics,
approach
and
to
like,
read mainly changes.
yeah, exactly, the approach. Videos make it more exam approachy rather than
Yes.
just
Yeah, correct.
just a random lecture, let's put it
Text
that
or
way.
something. Yeah.
Yeah. So great. And the next question that I have for you is that
Hmm.
for someone who's preparing for both NEET SS and
Hmm.
INSS, how should
Hmm.
the approach be? Like, both are
Hmm.
two radically different exams, but let's say someone does
Yes.
have a preference. How should the
Yeah.
approach be? For example, although these are rumors only at this point of time, but there is
Yes.
some truth to the fact that there's a, let's say, possibility that NEET SS won't be conducted this year. It will be
This
conducted
year.
in
Next
January.
year.
Yeah, in January. So, for example, although conjecture, but let's
Hmm.
assume that's true, that
Hmm.
the next INSS is going to happen in October end, and the NEET SS
Hmm.
is going to happen, let's say, in
Yeah.
January. So, what
Correct.
should be the preparation for someone? Let's say again, someone is preparing for pediatric oncology.
Hmm.
What should be how he prepared so that he's able to give his best shot for the INSS also,
Okay.
and in case that doesn't work out, he is also prepared for NEET SS that
Correct.
happens one and a half month later.
Yes, sir. So actually, I feel like whenever we have it in our mind, there's another exam to answer, we do not give our best for the first exam itself. He's like actually maybe even me when I answer NEET assist probably you always think, Are, there's another. I will you do my best later. Especially when you're writing the exam, if it doesn't go good, you feel from now onwards I'll do my best and answer the next exam. So the first exam itself, I feel you give your best and like probably I did not do it, so I will at least advise people. So we should like whenever you're answering a given exam, I will do the best which you can for that. Like think because currently we cannot like after the given time since we're all working, we cannot just wait and just spend our time. So like how I did, probably I wouldn't want anyone else to do that. So if that's not the case, then probably like for example, if somebody who's answering in October, I feel since now it is like June, there is plenty of time. So anyways, when you're answering ped oncology, suppose you have to read Lanzowski, but you have to read general pediatrics, that's for sure. So like general pediatrics will be there. It's a huge weight. It has a huge weightage even in NEET SS. So that's something preparation will be common for both INSS as well as NEET SS. So that one way will help. So there are ways like for example, if somebody is studying whatever is your time duration, suppose you have like maybe just even 2 hours a day, suppose you're studying, give 1 hour to the NEET SS part, probably like the general pediatrics, suppose you're starting, and give 1 hour to the ped oncology part, then similarly that way. So once you finish with general pediatrics, probably give the other like then start with probably the ped cardiology, but since if you want to get into INISS, then probably that 1 hour for the subject which you want has to be, I feel it shouldn't be replaced with anything else. And then after INISS, obviously, so if you're cleared INISS, then obviously your ped oncology, by then you will be perfect. Okay,
Hmm.
so and then just do the brush up of the all the other subspecialties that are there, and probably you can like we can clear and need assess
Basically, you're saying that on a daily basis, ensure that you're studying for your SS subject of choice, uh,
choice. Yes.
and give your best for
Yeah.
INSS instead of thinking कि NEET SS बाद में है.
Yeah.
And INSS nickel, if INSS gets clear, great. If it
We
doesn't,
wait.
then afterwards, then
Yeah.
brush up with the
There,
rest
there
of
is
the.
there is time,
Yeah,
correct. But
there is
if we
time
start
that
initially only for NEET SS, then probably INSS obviously like so
won't
we have to
be possible.
won't be possible. So either both ways, like then both won't be possible, I
I
think.
would actually advise everyone that people should nowadays they're actually. I agree. This you still probably have to get a single digit rank. It's not like you don't have to get a single digit rank,
Yeah.
but it's this is I think a really a golden, not a golden, but still a great time that you have 3 months for INISS, 3 4 months for
Yeah.
INISS. Prepare for your
Yeah.
subject of choice in
Yeah.
depth, and then simultaneously 1.5 hour for general
Yeah,
pediatrics.
general
And then for the
pediatrics.
next 3 months, you can prepare for NEET SS in the full flow in case
Correct.
INSS doesn't work out. But definitely give INI the shot it
Your
deserves
best
probably.
shot, yeah. Don't,
Yeah.
like, if we think that NEET SS is there in another 3 months, because that's what we usually do. Like, probably I have also done that. When you answer, Are, there's another exam. So if we like, we always think, Are, the next one, the next one. So it's like, then you're not able to give your best for the given, like, the exam which is coming. So thinking that there's an option later. If you think there are no more exams later, then you tend to give your best shot for the first time itself, like that.
Right. So next question is, how was the mock interview experience? Did it help? And how was the main interview experience? So that people also get to know about how the
Okay.
INSS interview works. Yeah.
Okay, so mock session interview, first I'll say, because there's no way for us to know what exactly is asked. So that was, I think, like what you provided us just before the mock session, like a few days ago, was, I think, good. Like, because we don't know what to read. Like, once you, because initially your full preparation was for MCQs, and now suddenly you don't know what exactly they're going to ask in the interview, and we just know that there's some part for general pediatrics and this. So when you took the mock interview session, I feel that was, like, for example, when you told us to go through statistics and some of the important topics, some of the recent like research articles which are provided by which is there by stalwarts of AIMS Delhi by Dr. Rachna Seth ma'am. And also that's when, and certain topics, for example, like when you had told us like retinoblastoma, the research, the ICMR guidelines which are come, we don't know about it, we don't go through it, but that's when you told, like, go through them. And otherwise we wouldn't have known if this mock session probably wasn't conducted. So that way it helped. The mock session was very good. Like, in terms of, you told us, like, focus on statistic, focus on maybe these, like, just go through some of the images, like, for example, in case of solid tumors, because that's how they start with case scenarios, and how would you probably go about it, like what are the DDs you will give. So that was one. The second thing, when the actual interview happens, I'll say it is actually very, it's a very tough interview. So that is there. Like, whatever preparation you do, I think probably will never be enough. But it is like 5 marks are given for general pediatrics, and 15 marks is there for the ped oncology part if you're answering for ped oncology. So in that ped oncology, again, they will ask you more about, one is case scenarios. Like, I had got a case on neuroblastoma, then probably, like, you tell your differentials when the history, after the history, you tell your differentials after the CT images which are there, and then how probably, if any complications, how would you manage that way. Second thing
I
is
we discussed
statistics.
the CT images of neuroblastoma. That's the one
Yes,
thing that we actually
yes,
discussed.
yes, sir. So because I had never thought, like, they will, how, what they will ask, and you had told us solid tumors, like, go through those images. And also, because normally we don't, like, since I have not been working in ped oncology currently, so obviously we won't be going through that, and that's when you told us, and it actually helped. Second thing was statistics part, like, you told us, because we wouldn't be reading so much about that. So that was one thing which was, like, you told us to read about RCT, about meta-analysis, and they had asked on RCT, they asked about, like, randomization, allocation, concealment. These are the questions, like. And in terms of general pediatrics, I feel it is, again, like, it's quite vast. So we nothing will be enough, obviously. So that's how. But like, there'll be one question probably, like, on ped nephrology, supposed by the ped nephrology. So one question on ped hematology, one again question on another thing which you told us, which was very helpful, was to read your thesis, like, and what statistics you have used in your thesis. So that's when they had asked about, like, what was your thesis, because normally we wouldn't think, yeah, why will they ask in this interview, why did you read, like. So that was one thing which was very useful, that you had told us, at least go to thesis, and what statistics has helped you in your results for your thesis. So that was one thing which was good. And yeah, so at least the mock session was good, that at least it could help us in what direction to go, what exactly to, like, expect over there. Obviously it cannot be, like, you cannot, like, tell exactly what they
Predict
will ask, because
exactly predict what
yeah,
they will ask, but
yeah,
that's why it's a mock
at
interview.
least, yeah,
But at
correct,
least,
sir.
yeah, that was the main purpose of having the mock interview. Like for a lot of people, this will be probably the first interview they'll actually give in life.
Yeah,
We are used
correct.
to giving MCQ exams. We're not used to
Yes,
giving
yes, it
interviews, right?
very true, true.
Yeah, exactly. So in that scenario, I think having been here and having gone through these, I think it's my responsibility, and it's also a pleasure to help the students who have
Yeah,
taken who have been here, to at least guide them. Okay, obviously, even I can't predict what the faculty is going to ask. The
yeah,
you know the but having said that, I obviously we know that these are the lines that they do end up asking, so that, like you said, you can focus on your thesis. You wouldn't probably
Yes.
ever have thought about your thesis as
Thesis,
as
correct.
something you to prepare for your interview. But at least when someone tells you that, okay, thesis has to be done, your thesis has to be refreshed before going for the interview, you at least do that. It's fully possible that even if they ask you some question on thesis, you still don't know, but at least you
Yeah,
knew that
correct.
that it has to be done in some way or the other. All
Yeah.
right. So thank you. I think that I think this would be a very helpful session for everyone. So
Yes.
my last advice to anyone who's preparing, especially for pediatric oncology or hematology oncology, is just go through the videos. The videos I have done on DocTutorials, they will be like your really quick ready reckoner, and you will get a broad overview of everything. You will get to know what is more important, what is not that important, and then when you read your Lanzowski, it will be a very smooth sail, I would say. It won't be a tough book to read, and then keep on revising Lanzowski. And definitely, if your goal is pediatric hematology oncology, you will definitely clear it. And when the time comes for mock interview, I'll be here to take another mock interview for you guys again. That will be my advice. And any parting words from your side, Dr. Rema?
Same. Like, first thing I'll say, if somebody wants, first is always, if you want to get through INSS, decide your branch and just work towards it. Like, for example, if it's speed oncology, Lenzowski. If it's neonatology, it is AIMS NSU protocol, and it's your Cloharty. So, and just, I feel we shouldn't be discouraged with the fact we have, suppose, 1 month only remaining. I did not do well. Because we are professionals, we don't have so much time. So, in whatever time, if it's 1 month, give your best in that, thinking that this will be your last exam of your life. And I think there it is, probably anything is possible, because I had never aimed to get into AIMS, but I'm just happy right now. That's it. Just work
Congratulations,
for your whatever your
congratulations.
goal.
Congratulations again, Dr. Rema, and welcome to the family. That's all I'll say.
Yeah.
So yeah, all right. Thank you.
Thank you.